Hey everyone, it's DrRic, and I wanted to give you a little update on my red yeast rice experiment. So during the winter of 2022-2023, I kind of went off the rails as far as not really caring about my diet. I had come off of a summer where I turned 60, where I hit all the metrics as far as low cholesterol, body mass index, fat percentage. I was doing okay at the age of 60 or turning 60. Now, a little bit too much enjoyment during the November, December, January months. So what I did was I figured I was off track and I wanted to get a baseline. I do have a baseline blood test from those times. And this is, I'll post this as a part of the video, but you can see that a timeline with Quest with these cardio IQs is this way. This is from 2021 and then moving forward. So I do these and I pay for them because I love self-experimenting. Back in 2021, I was plant-based, vegan, and I hit these numbers. These are pretty decent numbers as far as LDL cholesterol and total cholesterol and triglycerides. So I'm not here to tell you what kind of diet to use. And by the way, this is not meant to be a substitute for medical advice, so please take the information you get and bring it to your doctor. However, I do have a bit of risk as far as heart disease in the family, so I always try to modify and change and improve exercise, nutrition, calming practice, and sleep. But you can see that back in 2021, I hit the numbers pretty well as far as low LDL. The objective is an LDL around 70, and I got to 80s. And then total cholesterol and HDL, we don't really follow that because the data is not that strong, but I always like to follow triglyceride over HDL ratio and total cholesterol. So there's also other markers down here that we don't have to talk about, but just for the sake of this video, you can see how I did in 2021. You can also see how I did in 2022 when I went carnivore. You would think plant-based would bring me down low, and it did. But look at this, carnivore brought me down lower than plant-based. Does that make sense to you? So I have other videos, and by the way, if you aren't a subscriber, please consider subscribing to my YouTube channel because I put out information about self-experimenting and then common questions that I'm asked in the clinic by patients. So as I mentioned, I hit a really good groove. You know, the motivation was turning 60. So there's a whole bunch of crap that can happen, and I wanted to be prepared for it for that decade. So I hit the lowest ever. And again, going on carnivore and exercising as I usually do, usually it's power and muscle, I'm a muscle head, it gave me better numbers than I went when I was plant-based vegan. So I celebrated here, I had a little bit too much fun, mostly not caring about diet, continuing the exercise, probably being stressed out, being a small business owner. But I tried to bring it back in once I declared that I went off the rails and the LDL went higher. I tried to bring it back in over the next 3 months, and you can see the slow improvement. I changed around to low carb, I did prolonged fasting, I did intermittent fasting. I changed around a couple things. My exercise, I tried to increase because I'm training some folks to go with me to excursion, Mount Whitney. In fact, next week, so I'll post that. But this is the best I got. And this recent one in June, I was like, okay, nothing's working because I'm not really bringing down numbers. My LDL was 123. I want to get it back to where it was before. So the only thing that I did different was I implemented red yeast rice. Now, those of you who haven't seen my videos on cholesterol HPF red yeast rice, that's the #1 choice approved by Consumer Labs. I'll put the link down below. And then my most recent video on red yeast rice was a different brand, since I couldn't find my cholesterol, and I took my different brand. And these are the numbers that I just got. I didn't have enough money to pay for the big cardio IQ, so I just did the 4 calculated numbers, LDL, HDL, triglycerides, and total cholesterol. Look at that. Just to read it out, total cholesterol was 194. I'd like to bring that down to 170, but all I did was add red yeast rice to my current formula. HDL cholesterol 101. That's the highest HDL I've ever attained. And that's with red yeast rice. Most of the statins that are out there, those prescription medicines, they actually lower LDL and your risk, but they also lower HDL. I didn't change anything. I just added red yeast rice and it jacked up to my highest I ever got on HDL was 93, 95 when I was really cooking. 101 from a prior 79. So 79 is my most recent, 101 just with red yeast rice. Second thing, triglycerides, 32. Triglycerides, the best I ever got with exercise, 45. That's the top number here. 45 is the best triglycerides I ever got. 32 on the triglycerides. So typically triglycerides are going to go up when you take advantage of sugars, alcohol, sweets, excessive simple carbs, processed foods. That's spectacular. And the most notable was my LDL of 84. 84 on an LDL when previously 3.5 weeks earlier, it was 123. So to go from 123, maintaining my intermittent fasting, my low carb, and my exercise, and my sleep, 123 to 84, that's a spectacular, that's close to a 40-point drop in LDL. Now all the data that the cardiologist and I use say that you really have to bring your LDLs down. That doesn't exclude you from having a heart attack, but using the data that's known, if you bring your LDL down, if you exercise, modify your BMI, watch out for insulin resistance or hemoglobin A1Cs going greater than 5.7, and then stop smoking and get some good sleep, all that stuff together will probably decrease your chances for a sudden heart attack. In the United States, men, 300,000 or more, will die of a heart attack every year. And 50% of those men that die every year, that's 150,000, have no symptoms whatsoever. One of my patients just lost her brother, and he was a diabetic with some issues, but he was only 50, and that's terrible. Assuming that he was just changing and he died on the floor, he probably didn't have any symptoms, or he did not recognize them. And that's why it's important not only to always get your cholesterol levels, but also to empower yourself or ask your doctor, how else can I change my life so I don't have a heart attack? Whether you have a history in the family of genetics or you don't, I think the reason I do these fancy ones, Cardio IQ, is to get more data, like a total LDL particle count, APO, protein B, and LP(a). I have videos on that stuff. I'm not going to talk about it here. But just getting the calculated LDLs and cholesterols, I don't think that's enough. I think that you should be doing more. Now, the problem is it going to be paid for by insurance? I have no idea. I don't take insurance. If I'm worried about my patients, I will go outside the algorithm, what we're supposed to do as doctors, and I'll say, listen, you're higher risk to me than anybody else. I would not want you to get the standard. I would want you to get the big guy. So how do I make choices on that? Risk factors. If I have somebody that's intentionally not exercising, if I have somebody that is overweight, if I have somebody that smokes or has a family history of high risk or has diabetes or prediabetes, I think that those risk factors increase your chances, and that is already a red flag for me. So the idea of going to an annual wellness exam is not to just get a blood count, a comprehensive metabolic panel, and a vitamin D level. I mean, that's so cursory. I think it's to take advantage of that time in the room with the person and try to figure out, are you at risk? Are you not at risk? What kind of things can we change around? What kind of symptoms do you have? So that takes a lot of peeling back of layers. That takes time. And unfortunately, sometimes you don't get the time when you're with a doctor, and the doctor doesn't have the time because he's being pressed, or he or she is being pressed. So it's up to you as patients to be an advocate for your own health. So if you have questions, my suggestion is load up the questions before you go in, maybe even send them to your doctor the night before, and then address those questions, highest priority. Now in a 15 to 20 minute visit, especially if you have to do vital signs and all that other things, you might have to be succinct as far as 3 top ones, because think of it this way. If you have 15 minutes, you have 3 questions, and it takes 30 seconds to ask the question, but it takes 5 minutes to educate you and answer the question and give you some ideas. 3 questions, 5 minutes, 15 minutes, that's it. 3 questions is all you got time for. Now, if one of the questions is, how do I change my eye color? That's an answer that you can't, and that's done. But I think it's always important to list the questions beforehand, to be succinct, and to take advantage of the time slots that you're given. And or sometimes if you do get a clean bill of health, sometimes communicating with your doc using the portal that you have might be fair if it's easy questions. Now, if you give a litany, I have chest pain, I can't breathe, I pass out, now, those kind of questions sending through the email is not right. So you have to be advised about what's appropriate, what's not appropriate, and that's what you're supposed to get over the course of several months, years with your doctor to figure out what's appropriate, what's not appropriate. Can I come in? Are you paying attention to my numbers? What do I do in the future? How can I get healthy? So the most important objective is to rule out disease. And then from there, when you're in your visit, it's to see, are you optimized? Do you have any deficiencies? Am I good? Will I be able to live till 100, or do I have to look forward to some early death? And then finally, the low yield stuff, morbidity, issues, erectile dysfunction, muscle cramps, problems with thoughts. All those aren't killers, but they have to be addressed. And sometimes if you live to 100, but you got 100 different detailed medical problems that you're suffering from, that's not a great life. So we want to compress morbidity, meaning that you want to decrease as many medical problems as possible and symptoms as possible. Over the course of several visits, you might be able to get that with your doctor, but bottom line is, I wanted to give you guys an option that if you do have problems with statins, or if you don't want to take a statin, I do believe that red yeast rice is fair. It does bring down the LDLs, and those have been inevitably what we follow as far as early mortality. Now, will red yeast rice be equivalent to a statin? We'll never know because there's no head-to-head comparisons. But if we extrapolate the data of early death, and usually with early death or previous stents or bypass, the data says you have to really lower your LDL cholesterol to almost 40 now. I think you can take that information, but hopefully you can use a red yeast rice perhaps to your advantage. The quality is very important to watch for, and you always have to make sure that even that herb is not irritating your gut or your liver, so it requires more than just cholesterol testing. So while you're on a statin or a red yeast rice, it's always important to also modify your activities as you get older, change around your exercise program, exercise more, change around your sleep pattern, improve your sleep pattern, take care of the relationships around you. So all that stuff is very, very important because it all, in the end, if you can negate the risk, longevity is coming your way and independence will remain with you. So hopefully this gives you a couple of ideas. If you have your own red yeast rice that you use that's been approved by consumer labs, put it in the comments down below. Otherwise, if this helped you, or if you know somebody with cholesterol issues, having issues with statins, please send them this video, share, and I'll see you at the next one.